So all of the orthopedists in our group, in the Desert Care Network, participate in trauma call. And in the emergent setting, whoever happens to be on call is the one that will respond to the emergency room call and assist the patient in that setting. And then usually after stabilization, once the patient is physiologically stabilized and it looks like we've kind of mitigated the life-threatening injuries, then we talk about how to restructure the patient and rebuild the broken parts, if you will, be it the pelvis, femur, hip, shoulder, whatever body part it is that was injured. We have to think about how we're going to reconstruct that so that we can get this patient back to a maximal form of function.
When doing orthotrauma, the injuries you see are varied. We see things from fractures of your upper extremities to your pelvis to your legs. We see people that have been in motor vehicle accidents and motorcycle accidents and ATVs, or they tripped and fell. So we're here to provide care for all kinds of injuries. It is basically a center that provides different specialties that are available to you immediately. So you have everything from a trauma surgeon to an orthopedic surgeon to a neurosurgeon, all these specialties, and there's more that come together to be ready for you when you need them. If you've been brought into Desert Regional as a level 1 trauma, you'll initially go in through the ER, and there will be a surgeon there waiting for you, someone to immediately evaluate you to determine what injuries you have and the severity, and then he has access to all these specialties to consult them and basically take care of any of your needs, whether it's neurosurgery, orthopedics, and depending on what you have, we'll plan out your next steps. Whether it's surgical or potentially non-surgical, as you get better, and we'll get you either to a recovering facility like a rehab or home, and then follow you for the long term when you come back to see us in clinic.
For patients that have experienced significant trauma, it's really important for them to understand. It's simple to say, and having been through some traumas, I can say this with a little bit of empathy, that life goes on, and it's important to understand that the only person that can truly make your life better and progress is not your physician. It's not, believe it or not, your family. It's yourself. Your own attitude and your own approach. Each individual that's been through significant trauma understand that they control their own ability to respond and react to stress and what has happened. As people start to understand this, they greatly increase their capacity to heal and get through this when they understand that they control the ability to do so.